We know COVID-19 cases are up in the U.S., though it's hard to know exactly how much because people are testing at home or sometimes not at all. The latest numbers from the UK show infections there are up 18% week over week, and officials are blaming Omicron subvariants, which have also become dominant in the United States. For more on this, I want to bring in Dr. John Moore. He's a professor of microbiology and immunology for Weill Cornell Medicine. Doctor, thanks so much for joining us.
Morning.
Our partners at the BBC report 2.7 million people in the UK. That's 1 in 25 has COVID-19 right now. Is that the direction the United States is headed?
Yeah, most likely. It's the same BA.5 variant that is now dominating in America. It's dominating in Europe and it's dominating in America. So that number from Britain, if you extrapolate it to the size of the US population, it means around 15 million Americans will have COVID pretty soon, because this variant, BA.5, is highly transmissible and is capable of blowing past previous immunity caused by vaccination and infections, prior infections. So it's causing a lot of new infections and it's causing a lot of reinfections in people who earlier had, say, an Omicron infection in December or January. So we can expect this infection rate that we're currently seeing, which is pretty high, although not precisely recorded, it's going to get worse in the coming weeks. I think we're pretty confident about that.
And now there's another Omicron mutant spreading in India. It's known as BA.2.75. There a few cases have already been confirmed in the U.S. What do we know about this, and should we be concerned?
Well, we don't know a lot about it, but we're going to see this pattern of continuous evolution of these Omicron variants, and they'll accumulate more mutations that will increase its transmissibility and resistance to immunity even further. It's hard to say whether the new variant reported out of India is going to make a difference. It's probably only marginally superior in its transmissibility to the one we've got. So, let's focus on the devil we know and not the devil we don't. But, to put a sense of perspective on this, I mean, BA.5 is infecting a lot of people, but it is not killing a lot of people because prior immunity from vaccination or infection is still working well to keep most people out of the hospital and keep them alive. So we're seeing a lot of infections, but they're mostly of the at-home variety. I mean, my daughter got infected at a bridal shower at the end of last week. So she's sitting at home, she's got a very bad sore throat, is feeling pretty rough, but there is essentially no chance that she's going to end up in hospital. She infected her husband, same dynamics. There are friends of hers who are at the same party. I mean, people are going to social functions like the pandemic is over, but it's not over. And with a highly transmissible variant around, then we need still to be on our guard, because it's not fun to be sitting at home feeling pretty rough for a week.
No, this is true. And the White House said today that it's working to make vaccines, masks, and tests available in an effort to fight the BA.5 subvariant. And now the Washington Post is reporting that the administration is working on a plan to make second boosters available for all adults, not just people who are over 50 or people who are immunocompromised. The question, of course, Doctor, is game this out for us. Given that it doesn't seem at this point that our politicians are ever going to go back to where we were back in March of 2020, where businesses and entire cities and states are shutting down, and given that there are people who are becoming infected, but they are not going to the hospital and they are not dying, for those who are not immunocompromised, what does this look like in the years ahead? I mean, is it one of those things where, like, some people find out after, like, I've heard pregnant women finding out that they've had toxoplasmosis, right? That they've been exposed to it. They never knew they were exposed to it until they actually took a blood test, but it really didn't do anything to them. Is that what we're talking about?
Yeah, I think it's likely we're going to have to learn to live with a virus that is circulating in the population and is going to infect a lot of people with relatively mild infections, providing they've been vaccinated. I mean, I read that Washington Post article. I've spoken to a number of people about this dynamic. There are as many opinions around as there are people with opinions. It's very complicated. It's not clear. Certainly, a lot of people I respect greatly think you just can't boost your way out of this situation. The boosters give you transient increases in protection against infection, but it's not as large as it used to be because the variants are much more resistant to immunity than they used to be. Anyone who's immunocompromised, anyone who's in poor health, anyone who's a senior, anyone who's just got medical conditions that place them at risk, absolutely they should get a booster when recommended. But it's much more controversial for younger people in good health, because the question is this a prudent thing to do over time? And the immunology is pretty complicated here and is not yet fully understood. So there's a lot of guesswork going on. I mean, educated guesswork, but it's still not completely clear what the right policy should be. I don't think anyone knows this with certainty, but we're just going to have to learn to live with a virus that is causing a lot of sickness, but not a lot of serious disease and death. And so it's a very different dynamic that we had to what we had in 2020.
So, doctor, living with it, does that mean living with it the way we live with the flu, which is we typically don't take a lot of precautions and we hope we don't get it, but sometimes we do?
It may well come down to that. It's unfortunate. Nobody wants that. Nobody wants to see people getting infected and having to spend the week recovering at home. But there may be not much we can do about this unless and until better vaccines become available, better drugs become available. There's additional work going on. There's research and development. There are better vaccines on the horizon. There's a new vaccine from a company called Novavax that is still waiting for FDA approval or authorization, although the government has just bought a stock of it. That seems to be performing quite well in trials. It's the vaccine I had in a clinical trial in 2021. So, that will help, but it's not going to completely change the face of the epidemic. There are newer, better vaccines that are in development, but they're a couple of years away because the progress of research has slowed, funding has slowed. We're not putting as much effort in as we did in 2020 to do things with warp speed. That's not happening anymore. So, in the long run, there may be better solutions, but for the next several months, I think we're really going to have to learn to live with what we're seeing nowadays.
Wow. Dr. John Moore, thank you very much.
You're welcome.